New COVID cases in Hong Kong remain in the high double digits, with half the infections diagnosed today connected to the expanding dance cluster. There's also concern of a possible new cluster in Lohas Park. Johanna Chan reports.
There were 82 new COVID infections today. 49 transmissions were traceable and 32 were linked with the dance cluster, which has now expanded to 552. There are fears that a construction site could be the source of a new cluster, following 3 confirmed infections and 8 preliminary positive cases at Lohas Park Phase 1.
There are lots of person-to-person contact in the construction site worker, and not everyone can wear a mask in that situation because it's quite hot sometimes, and sometimes they work in the enclosed environment, and so it is not unexpected transmission may occur in these settings.
The site has 900 workers and the contractor is working out how they can be tested. There were 5 confirmed cases and 8 preliminary positive at the Fong Shi Chun Day Activity Center in Shao Kei 1, while staff and residents of care centers in Tai Kok Tsui and San Po Kong have quarantined after more tested positive. A Tsing secondary student found to be preliminary positive yesterday has been confirmed as a patient. A student at another school that he visited also fell ill. A substitute teacher who works at 2 other schools also tested positive. A doctor at Queen Elizabeth Hospital tested positive, while a colleague tested preliminary positive. The 2 doctors are said to have traveled on public transport together, but were not in contact with COVID patients. Staff of an outsourced company hired to take samples from the Jockey Club Clinic in Kennedy Town to testing centers accidentally left 6 samples in the boxes. 6 people were asked to redo the test. Authorities meanwhile have flagged the Pine Tree Hill Seafood Restaurant in Tsim Sha Tsui as a COVID hotspot after customers and workers tested positive. There were also 10 imported cases today, as total infections in Hong Kong so far rose to 6,478. Johanna Chan, HKIBC.